Hi again. We are in the acute medicine setting, and we have a patient came over to us today, and he had cellulitis. Cellulitis, which is infection to the skin, mainly was stripped, and in a special situation, you will find some staph cellulitis as well. So again, how to clerk a patient with cellulitis, how to admit and when to admit and to go through everything with the patient. Usually, the patient came in with cellulitis to the hospital. He will be admitted for social reasons, or he have some antibiotic by his GP, but the cellulitis is spreading and do not responding, and the patient mobility has been declined. Okay, so how to clarify it? How to clarify why you needed to admit the patient, because it is one for your decision. So again, you will put the patient name, date of birth, the patient label, the date, the time. Documentation is the most important thing in UK. Documentation. After 10 years, you might have a case which mentioned that this patient you saw 10 years ago with blah 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 blah. What did you do? And if you didn't document what did you do, or what did you say, it will be a big issue. All right. What's the patient age? So the present complaint is decline mobility or pain to the left leg, right? And put your name and grade and the date of the time, and then you let's us because let me try to put this one in place. So can you see the writing here? I'm sharing the another screen now.
Yes, I see.
You can see it now, yeah.
I can see it.
Okay, so how to write it, and how much you will need to write. You will need to write a lot. You need to write a lot. Okay. So let's say, where did it go? Make it a little bit smaller. So let's say 85 years old lady and presented. Oh, da, 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 da. So years old lady and presented with, and you mentioned what she presented with. So let's say she presented to you with redness to the left leg and pain, but no oozing, no fever, and mild tenderness, right? And she has been treated with oral antibiotics by the GP, but the redness is spreading now, right? And not responding to the treatment, and then explain why you admit the patient. And her mobility has been declined. Okay, and continue explain what's going on with this lady. All right, so you will continue explain has been declined, and she cannot do the usual daily activities, right? And then explain why, where, and with who she lives. So she live in, let's say, a bungalow and alone with four carers a day, but they cannot cope, right? So you explained what is the situation, and why you are admitting the patient. So it is mainly, so the diagnosis here, uh, Bingalo, Bingalu. So the diagnosis here. So if you are putting diagnosis, so your diagnosis will be cellulitis after examination, of course. Cellulitis, and social admission. All right.
All right.
So you did put here the present complaint in details why you are admitting the patient. What is the reason behind admitting the patient? Okay.
Yeah.
So let's go to our clerking sheet where you document everything and see what's going on there. Again, uh, just let me, yeah. So the past medical history, the patient will have lots of ongoing stuff, lots. So let's say she has diabetes, hypertension, osteoarthritis, and diabetes mellitus, and then everything else. So you will put the name again, then examination and the medication. She is in lots. She is on metformin, stigoliptin, apixaban for AF, and what's the dose as well, 5 milligram or 2.5 milligram twice daily, and she is on some Parkinsonism medication as well. Takes the smoking history, where she's lived, how many carers again here, and if there is any mobility aid. To put what? Do you remember the frailty score? The frailty score.
Yeah.
Is she mild frail? Is she moderate? Is she is severely frail? Is she for ward level care? Is she for full escalation? Does the patient has do not resuscitate DNA CPR in place or not? Okay.
Yeah.
Do not forget to put these details, please. Please. Okay.
Okay.
And then take the vital signs again, the heart rate, the blood pressure, the respiratory, the temperature, the news score, and the news score. The news score. Why? Why is the news score? Do you remember?
uh, I can't remember.
The
It's,
sepsis pathway.
uh,
The sepsis pathway. All the patient came to you in the hospital, came to you, so you might need to give her something. She
mm,
has infection, this lady. So sepsis
yeah.
pathway, sepsis protocol. Do you want me to explain it again, or you already know it?
No, I not.
Good. Go through the sepsis pathway, please. Every single time the patient came over to you, please go through the sepsis way.
Okay.
Is the patient has a risk of sepsis or not?
Mm,
Okay.
okay.
And consider again the oxygen, the blood culture, the urine culture, chest X-ray, the ECG, everything, and consider the antibiotics. All right. And if the patient needs fluids, and take the VBG for lactate, please. All right.
Okay.
I will not explain it again. Okay.
Okay.
Good. So we will go through the clerking sheet till we reach the examination. So examination for such ladies or such patients who mainly most of the times they are frail and they cannot mobilize and all of this stuff. So make sure that you are examining the peripheral pulse. Make sure you are examining the peripheral pulse, because yeah, it might be redness and cold, so it does mean
Mm,
that the patient had ischemic changes in the leg, right?
okay.
So make sure that you are examining the peripheral pulse and the touch as well. Okay, respiratory examination is really important because some people came with lower respiratory tract infection. Okay, and the as the skin thing, both the finding, so it's redness, hotness, and tenderness to the skin. Every single patient came into you in A&E or came into you and you will be admitted, please do chest X-ray, please do ECG. Even if it is not indicated, please do ECG. Please request a chest X-ray to rule out lower respiratory tract infection. Every single patient, please. All right.
Right.
Do the bloods, and we will put the plan together right now. Okay. Happy with that?
Yeah.
Good. Easy case, isn't it?
No, it's easy.
It is really easy case. Well,
Yes.
let's say something here. So The patient came in, she live in Bangalore alone and full carers, and she is frail, frail, and DNA CPR in place. So if this patient deteriorated, you will not resuscitate this patient. Okay?
Okay.
So we know now that as you told me earlier, the diagnosis for this lady will be cellulitis and for social admission. So you need to put the plan now for this lady. Okay? As as we go through all of our patient, you will do the bloods, which would the bloods would include the FBC, U and E's, and the liver function test and the blood culture, right? And if there is a wound, or boss, you will do swab as well, swab culture.
Mm.
And if she is bringing sputum, do sputum culture, right?
No.
And for every patient came to you, you will need to do chest X-ray, and ECG, please. All right.
Okay.
And you will do VBG for this lady. Why? For sepsis protocol to find out about the lactate, and you will find it is less than 2, so there is no need to do anything. All right.
No.
So now you will need to give this patient some antibiotic. It is cellulitis, isn't it?
Yes.
What antibiotic will give?
Flu Sclav.
Flucloxacillin.
Oh, Flu.
Yeah, flucloxacillin is the first line according to the NICE guidelines. You will find the NICE guidelines in the drive. Is first guideline is flucloxacillin, all right, and it is 1 gram QDS for 7 to 10 days. All right,
Uh,
okay. If she is allergic to flucloxacillin, give clarithromycin, all right,
uh,
and make sure that you are holding the statin to avoid the prolonged QTS. Okay.
yeah.
So if you are giving patient clarithromycin, make sure that you are holding statin. All right.
Okay.
All right. If she cannot have it for whatever reason, you can give doxycycline. Okay.
Okay.
You'll find all the numbers and all the doses in the guidelines. You'll find it there. Okay. Good.
Okay.
So this patient, you treated her from the infection, and if it is sepsis protocol, you will put a catheter in and you will give some fluid, and you will find you will find about the oxygen saturation. So this patient came in for social admission, isn't it? Yeah. So
Yeah.
you will give. So after you are giving the antibiotic, and we are giving flucloxacillin here, which is the first guideline, the first antibiotic in the guideline. So you will need to ask the physiotherapy team and occupational therapy team to come and see the patient to prepare or for rehab, to send her home, right? For
Okay.
rehab. Because you will not admit the patient for long time. You just need to control the infection and then send her home. Yeah?
Yeah.
Send the patient home. BT and OT, physiotherapy and occupational therapy. Okay? And make sure you didn't miss about the TTO or the discharge letter. Write the discharge letter. Make sure that everything in place. So when she will go home the next day or 2 days after or 4 days after, everything would be ready for her. All right.
All right.
Okay. So cellulitis, it is a really easy one, really easy one. But there is something you need to have a look at. Cellulitis. Let me share something with you. So this one is a BCDS guidelines, all right? So I did forget. We need to mark. We will need to mark the cellulitis. To mark with your pen. To mark the cellulitis, and take swabs. if there's something or some oozing. Can you see the cellulitis?
Yeah.
Redness, hotness, swelling,
Mm.
cellulitis. This is cellulitis. You can take some swabs from here as well. Okay, another case of cellulitis, and this is cellulitis on top of edema, which we called it cellulitis associated with lymphedema. Can you see this leg is absolutely fine,
Oh.
and this one is cellulitis. Okay, this one is changes in both legs. Cellulitis only in one leg. Cellulitis came in one leg. If two legs are the same, if two legs are the same, it does mean it is not chronic cellulitis. There is nothing called chronic cellulitis. All right? The
Yeah.
patient is afebrile and everything is fine.
Mm.
And you will find the changes, eczematous changes in both legs. Right? Again, another case of cellulitis with big pulley. This is cellulitis and diabetes. So redness, hotness, tenderness, and some sort of uh, gangrene in the hand, which is looking very, very bad, as you say. This one is cellulitis in the ears. This one is erysipelas in the eyes and need Comox-Clav IV. And this one Comox-Clav IV as well. Right? And yeah. Yeah, that's it. And that's enough for today. And thank you very much.
Thank you.